Lenval Bloomfield, MP from, is it Portland? From Portland with us. Next to him is Minister without portfolio in the Ontario government. Associate Minister of Portfolio and the Minister of Finance. My apologies if I get it wrong.
Mr. Chair, may I make a suggestion? Could you ask them to introduce themselves?
Yes.
It might be better.
Okay, thank you. Thank you.
Okay. I know more about themselves.
Everything could start.
Could you stand, please? Start at the beginning, yes? And could you stand, please? Thank you.
At your command.
Request.
Good afternoon, everyone.
Good afternoon.
I am Dr. Lindale Bloomfield, Member of Parliament for East Portland, in the parish of Portland, and a medical doctor who is greatly interested in the diasporic activity and agenda that we are present with here today. Thank you.
Great.
Good evening, everyone. I'm Mitzi Hunter, and I'm the Member of Provincial Parliament here in Ontario, representing the riding of Scarborough-Guildwood, and recently appointed as the Associate Minister of Finance and responsible for the Ontario Retirement Pension Plan. And it's a pleasure for me to be here and to join you today, of course, as a born Jamaican. Sheila Sealy-Monteith, High Commissioner for Jamaica to Canada.
Luther Buchanan, MP East and Westmoreland, Minister of State in the Office of the Prime Minister, on special assignment to the Ministry of Health with responsibilities for primary health care infrastructure.
Arnaldo Brown, Minister of State, Foreign Affairs and Foreign Trade.
I'm Evelyn, retiree. Well, during my retirement, I'm the Executive Director of the Jamaica Diaspora Institute.
Canada Steele, President of the Jamaican Diaspora Canada Foundation.
Okay, thank you very much. I think it is the appropriate time to mention that this forum is being hosted by Sunnybrook International at Sunnybrook Health Science Center. All the other at least tomorrow and the next day. Unfortunately, we do not have a representative from Sunnybrook here today, and I tell you why. Martin Gervin, with whom we have been working previously, he is the Vice President of Strategy and Planning for Sunnybrook International, and he has a cross appointment with Sunnybrook Health Center as Director of Innovation. So he and his entire team is in the air right now coming back to Canada. They get in at midnight. So, and they couldn't find a replacement because the organization is so busy. One of his colleagues is being bereaved, his mother has died, and so on. So as a result of that, they couldn't be represented here. Nevertheless, Sunnybrook is a formidable partner. Believe me, if you really want to have somebody to be in your corner, Martin Gerben is one that you should be with, and the Sunnybrook organization, the entire Sunnybrook organization. I tell you that when I was asked to, when I got the email from Wayland saying we want Canada to host this, well, within 15 minutes I sent an email to 2 people in the Sunnybrook organization, Martin Gervin and Dr. Andy Smith. Dr. Andy Smith at that time was the head of the cancer program at Sunnybrook, and the Odette Cancer Institute at Sunnybrook. He's also a cross chair of surgery at the University of Toronto. And I sent it to him, and within 1 hour and 28 minutes, I got a response saying yes, and we will host. That is awesome. It doesn't happen in formal organizations or government. But that is the bar with Sunnybrook set. And so, this is how they have worked with us over the year that we've been planning this conference. So it is regrettable that they are not here tonight. However, be prepared. They will be hosting you on their compound or on their campus tomorrow. And you will have a wonderful conference there. At this point, we will have some greetings. Now that people have introduced themselves, do we still need to do greetings from the same way? Yes, okay. So let me look at the paper now and say, yeah. So we have, there should be a greeting from Wayland Richards, the chair and co-founder of this network. But Wayland is unable to be here tonight. His plan was to be here for Friday, but he was to send a message. I don't know if he sent it to anyone already. If no one has a special message from him, you have no, yeah, right. So Wayland's message, he does have a message in the official program, which was different from the greeting. So now we'll move on, and we will have a greeting from Mrs. Celia Grandison Marquis, who has traveled all the way from London to be here with us.
Ma.
Oh, I'm sorry. Oh, I'm sorry. To the whole I skipped, I looked on the back page rather than the front page. That's what happened. Something was correct. Yeah, okay. So we have a last Okay, so at this point, we have remarks by Her Excellency Sheila Silliman. And then
The Honorable Arnaldo Brown, Minister of State of the Ministry of Foreign Affairs and Foreign Trade. The Honorable Luther Buchanan, Minister of State in the Office of the Prime Minister. The Honorable Mitzi Hunter, you've already heard, she's the Associate Minister of Finance in the Provincial Government of Ontario. I'd like to recognize the other special guests at the head table. And with your indulgence, I'd like to also recognize a few other persons. Mr. Seth George Ramakan, our Consul General. Dr. G. Dixon, who is a permanent secretary in the Ministry of Health. Major Richard Reese, who is at the front here. Dr. Michael Vaughan, who is the Honorary Consul for Jamaica at Victoria, and I think he's sitting all the way in the back. We also have with us Mr. Vivian Scully, who is the Regional Director for Jamaica Promotions Limited here. Ladies and gentlemen, it is a source of pride for the Jamaican diaspora in Canada that the members have led the charge of this initiative to give tangible expression to the interest which all of us take in strengthening the health sector in Jamaica. I therefore want to congratulate the organizers of this first Diaspora Health Forum under the leadership of the President of the JDCF, Mrs. Valerie Steele, and Mr. Kingsley Gilliam, Principal Organizer, who have worked with great dedication to see this to fruition, and we anticipate the success of this encounter. Let me add my words of welcome to all of you. Those of us who have been spending most of our time in Canada will understand my desire to extend a special welcome to our visitors from Jamaica, the delegation led by the two ministers of state. Their presence here is a testament of the firm commitment of the government of Jamaica to work closely with the diaspora and other partners to pursue appropriate activities which are critical to achieving the objectives of national development. No one understands this more clearly than the Honorable Arnaldo Brown, who bears responsibility for diaspora affairs in the Jamaican Foreign Ministry. It is a matter of record and a proud one for us that his first overseas visit as minister was to Canada in February 2012. And out of which he was able to secure an early appreciation of the strength of the diaspora in Canada and the challenges and opportunities facing the government-diaspora relations more generally. I believe, therefore, that it is quite fitting that he's returning to Canada to resume his contacts with the Sunnybrook Health Services, among others, and with the benefit of a continuously expanding set of activities on the related agenda. Under his leadership, and to his credit, the successful 2013 Jamaica Diaspora Conference made important strides in concretizing the progress which has steadily been made and in paving the way for future cooperation. He has worked closely with private sector partners, given his conviction regarding the important role they must play in the relationship. He also understands that no country is an island, rhetorically speaking, even when in geographic terms we are defined as such. And accordingly, the partnership in which we have engaged with the International Organization for Migration for a Diaspora Mapping Project currently underway is the latest among the initiatives in which he is engaged. There is no doubt about his passion in furthering the diaspora engagement to mutual benefit. He's well equipped to do so, given his professional experiences and personal attributes, all of which pale in significance in the impact of his alma mater, Glenmuir High School, on his formation, one which I share. I am therefore pleased to invite him to address us. Thank you.
Thank you, High Commissioner Sheila C. Monteith, colleague ministers, the Honorable Mitzi Hunter, MPP, Associate Minister of Finance, Government of Ontario, my colleague Minister of State, the Honorable Luther Buchanan, as he indicated to you, is Minister of State in the Office of the Prime Minister and assigned to the Ministry of Health. So he's a very important minister. Our Consul General, Seth Ramakan, Mrs. Valerie Steele, President of the JDCF, Mr. Kingsley Gilliam, who is the, I would want to refer to him as the Energizer Bunny, behind this very important health forum, I also want to acknowledge the presence of our Permanent Secretary, Dr. Jean Dixon from the Ministry of Health, Major Richard Rees, Commissioner of Customs, and my colleague, Member of Parliament, Dr. Linval Bloomfield from Eastern Portland. I too am a Member of Parliament, but I'm from the plains of St. Catherine, central St. Catherine to be exact. I also want to take the opportunity to recognize Celia from the United Kingdom and her husband. She stood earlier. Put your hands together. And Claudette Powell, I'd want to acknowledge her presence if she could stand so you could see her. She's from the United States. And I must tell you that Claudette has been everywhere that we have had a diaspora event. So everywhere I go, I see Claudia, and I think she needs to be commended for that. She was in Jamaica in February when we had a historic diaspora education summit. Unprecedented. The minister and I were speaking when I just came arrived, and we were speaking about the strong commitment and connection that members of the diaspora have to their alma maters. And this particular summit was different in the sense that it took a global view of the education system in Jamaica. So it's not replacing the connections between the alma mater, but it's complementing that relationship. And the members of that task force have committed to finalizing a 6-year plan to work with the stakeholders in Jamaica in terms of enhancing the education system in Jamaica. It was also historic from the point of view that it was a partnership between the members of the diaspora, the Ministry of Education, the Jamaican Teachers Association, the Early Childhood Commission, and a slew of other organizations in Jamaica. And I think it's an important step. And it's also important in the sense that it has borrowed from the health sector. That is a critical point. I know Claudette was waiting for that point, because the fact is, in terms of the level of support that Jamaica gets from the diaspora, the health sector is one of the strongest areas of commitment and involvement. On average, there are over 100 plus medical missions every single year to Jamaica. I think in 2012 there was about 172 in 2012. And the important thing is that in the respective locations in Jamaica, all the hospitals have a health liaison person who's connected with a health liaison person in Canada, who's connected with a health liaison person in the United Kingdom, who's connected with a health liaison person in the United States of America. And what this allows is for the streamlining of the support that is being given by the health professionals that we have across the globe and in Jamaica. And I'm sure you will agree with me that our health professionals are some of the best, if not the best, in the world. I'm sure you will agree. And in fact, this is not anything that is new. This is a 200 plus year tradition and legacy, because a Jamaican named Mary C. Cole left Jamaica, traveled to the Crimea, where she performed excellent work in the field of health, and where she provided support to persons who were in need of care. And this is a tradition that we have, and it is a tradition that we have to preserve. And therefore, I personally was very happy when efforts were made to remove her from the curriculum in the United Kingdom, were or stopped by persons organized and engaged. There's an organization called Organize the Black Vote, right? That campaigned to ensure that the legacy of Mary C. Cole and the work that she did in Crimea, which rivaled Nightingale, and as far as I'm concerned, would have overshadowed Nightingale if you ask me. You can call me biased, I don't mind. Right? But the fact is that there is an object lesson in that we have to be engaged and we have to be organized. And it is the engagement and the organization that has brought about this important forum today. And I want to say how proud I am to have come here and to meet a colleague minister who is holding an important portfolio as finance in the province of Ontario. That can only be possible if we are organized and engaged. And if I have any message here this evening, it is simply that as Jamaicans, wherever we are, we have to be organized and engaged. Very important. And everywhere I go as a member of the administration engaging Jamaicans, that is the message that I take to them. That they have to become organized and they have to be engaged. And one of the initiatives that we are rolling out to strengthen the organization and the engagement is the Diaspora Mapping Project. This is a project that the diaspora themselves had recommended from 2004. We are now 2014, 10 years since the recommendation was made. And when you analyze every diaspora relationship, because Jamaica is not the only diaspora relationship, we're not unique in that regard. But as with everything else that we become engaged in, we can be the best in that regard, which is where we intend to go. But to become the best, we have to be organized and engaged. So we are laying the foundation and the platform for that organization to be deepened and for the engagement to be strengthened. And what we have done is that we have partnered with the International Organization for Migration. We have established a website